to PCOM Perspectives. I'm your host, Dr. Jay Feldstein. Today, we're meeting with Karen Giddens, MLS, the director of the Master of Science in Medical Laboratory Science program at PCOM, Georgia. The Medical Laboratory Science program is designed for students who aspire to work as medical technologists, key players on the healthcare team, and for those who are working in the field and want to add to their credentials. A resident of Moultrie, Georgia, Karen has been a practicing medical laboratory scientist for more than 20 years. She has a wide variety of experience, including working as a laboratory director of the Southern Interventional Pain Center, a large 3-clinic operation with centers in Georgia and Florida. In addition, she has worked as an adjunct professor at North Florida Community College and as a medical technologist at Colquitt Regional Medical Center. She was the Medical Laboratory Science Program Director and an assistant professor at Thomas University, and a division chair of math and science, also at Thomas University. Karen holds a master's degree in education technology with a concentration and graduate certification in online education from Boise State University. In addition, she earned a Bachelor of Science in Biology and Medical Technology from Auburn University. She has earned graduate credit in forensic science, along with a graduate certificate in forensic serology and DNA from the University of Florida. Welcome, Karen.
Thank you. Thank you for having me.
Well, thanks for being with us today. Can you describe the role that medical laboratory scientists play on the healthcare team?
Sure, I'd love to. Medical laboratory scientists perform an array of laboratory tests and analysis on blood and body fluids. This aids in the diagnosis and treatment of the patient to the medical provider, giving him or her key insight into what's going on with the patient in terms of pathology. Medical laboratory scientists also interact with the entire healthcare team, which that works to provide timely, accurate results to ensure prompt and adequate treatment for patients. Typically, our orders are derived from physicians, physician's assistants, and nurse practitioners, but we do interact with nearly every member of the healthcare team during that process. While we often interact with nurses being our primary caregiver for a patient, we also interact with pharmacists while monitoring certain medication levels, radiology techs prior to administering certain contrast material, operating room staff during surgery cases, as well as specialty caregivers such as oncology, dialysis, pulmonology, and even down to the biomed and environmental services departments.
I understand that there will be 2 tracks for this program. Can you please describe these tracks and the types of students they are designed for?
Sure. We're going to be offering 2 different tracks, one being the pre-professional and also the post-professional. The pre-professional track is actually designed for students wanting to enter the medical lab science profession for the first time. This is designed for someone that wants to gain their certification and be able to work in hospital and reference laboratories. Also, to gain their certification and become employed in the medical field by the American Society of Clinical Pathology, which is the certification exam that they will complete upon having their degree conferred. An optimal candidate for this route would have a conferred degree in a biologic or chemical science with some prerequisite courses such as biology 1 and 2, chemistry 1 and 2, even anatomy and physiology, and of course, math. These students will take courses during the first year, which are hybrid, that is having an online didactic component coupled with once a month campus labs. Our post-professional program is designed for students that have an undergraduate degree already from a NACLS accredited program in medical or clinical laboratory science. They also have to be certified by ASCP or AMT as a medical lab scientist. And these individuals would be interested in furthering their education to obtain positions such as supervisory, leadership, management roles, and also possibly qualifying them to teach or serve in other roles such as education.
So I have a couple other additional questions for you. One, can you explain the difference to our lay audience that may be listening to this, the difference between a phlebotomist and a medical laboratory scientist?
Sure. It is often very confusing because typically the patient would encounter the phlebotomist, which is the person that draws the blood or obtains the samples from the patient. Oftentimes, the patient thinks that that is actually the person that's running the testing for them. However, it is actually a medical laboratory scientist behind the scenes that performs all of the analysis. While the phlebotomist collects the samples and brings them to the lab, they check them in, log them, process them through centrifugation, sometimes special techniques. But the testing and reporting of the results actually happens by the medical laboratory scientist.
That's very helpful because I think a lot of people, like you said, are confused by the two. My second question is, most people think that medical laboratory scientists from a job perspective are just restricted to hospitals and outpatient laboratories, but isn't it true there's a wide array of job opportunities for people with a master's degree in laboratory science?
Absolutely. Typically, most people do think of hospital laboratories. However, hospital laboratories, no matter how large the hospital itself may be, the equipment is, there's millions of tests out there that could be run that a provider has the opportunity to choose from. So there's no way that the hospital would be able to encompass all of the testing within the confines of their laboratory. So typically what happens is we use what's called a reference laboratory. Common reference laboratories are like ARUP or Quest Diagnostics, LabCorp, something like that. And these are larger laboratories that they offer much more specialty testing than what we can do at a local region. So typically reference laboratories are also a good place that employ medical laboratory scientists, as well crime labs, toxicology labs, DNA labs, water treatment facilities, and even in the manufacturing process. All of the food and beverages that we consume have to go through a quality analysis or quality control process and test to make sure that they are free from bacteria or contaminants that could harm the general public. So they often employ laboratory scientists that do microbiology and chemistry analysis on the products that they produce.
Well, thank you. I'm sure you've got a couple questions for me as well.
I do actually have some questions for you. I know that you were trained in emergency medicine. Can you add some insight for our listeners into the role that medical laboratory science plays for healthcare providers who diagnose conditions and provide treatment regimens for their patients?
Well, I think the greatest role of a medical laboratory scientist is, as a provider, and especially as an ER doctor, is that you trust the results that you're getting back. That people need to understand, physicians make a physical diagnosis based on a history and physical exam, but a lot of times you're very dependent on the lab tests for your diagnosis and treatment. And in the ER, as I'm sure you know, we always want everything stat. So, we're the highest priority. We want it done quickly, and we need to have confidence that the results we're getting are accurate. So laboratory scientists are as an integral part as any member in the healthcare team, because inaccurate laboratory results can result in life or death situations from not only a diagnostic, but from a treatment standpoint. So they're very highly valued members of the team that are kind of behind the scenes, right? You write the order, you see the blood go back, and then boom, you get the results. Now, today, everything comes up on the computer screen. In the old days, it was all on paper. Now everything's digital. So, the ordering provider just pulls the test up on their screen. But, laboratory science is a large part of medical diagnosis and treatment. They're kind of the unsung heroes that are behind the scenes of healthcare and are a very important part of the whole healthcare system.
That's awesome. We love to hear that. I have one other question. So what are the qualities and attributes that you would like to see in a medical laboratory science that provides those results to you as an ordering physician?
I think we all make the assumption that the people providing the testing are well-trained, are certified and qualified, so that our confidence level is high, so that we know that 99.9% of the time, the results we're getting are accurate, because patients' lives depend on it. So it's you want to know that that person has been adequately educated and has gone through a comprehensive training program and has passed licensing exams and tests by certifying bodies that you alluded to earlier. And I don't know if you're a television fan, but there's a series on right now talking about Theranos. And most people may or may not be familiar with Theranos. That was a company that was started about 10, 15 years ago, who tried to create a diagnostic lab test where off of one drop of blood, they could run 100 tests. And they had great difficulty getting that achieved and designing a device that could do that. And that ended up being one of the largest fraud cases in the country from an investment perspective and just from laboratory diagnostics. So that kind of just shows how important laboratory testing is and the confidence you have to have in whoever and wherever the testing's being done. So I don't think we can underscore how important it is. So I think the people that come to the program, will be turning out qualified laboratory scientists.
That's my mission. That's what we're hoping for, is to put out high quality graduates armed with the knowledge and skills.
Well, that is our goal. And we look forward to doing that with your direction and guidance. So Karen, I just want to thank you for joining us today. I look forward to working with you to establish the college's first medical laboratory science graduate degree. To listen to past episodes of this podcast and become a subscriber, visit our SoundCloud page or find us on iTunes by searching Philadelphia College of Osteopathic Medicine. I'm Jay Feldstein, and this has been PCOM Perspectives.